Hi everybody, I'm Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today's topic is collecting patient copays, a topic that definitely is worth talking about. It won't be a long video, but it's definitely hopefully an informational video for you. The one thing that a lot of doctors' offices, owners don't know about is that collecting a copay is a requirement if you're contracted with an insurance company. I would encourage you again, like I have told you in many videos, to make sure that you read and understand those contracts that you sign as participating with those payers. And a lot of times it will have something in there regarding what you can collect from patients, what you're expected to collect from patients, and the copay will be mentioned. The copay is a contractual agreement between the patient and the insurance company when they sign up to be covered by that entity. The copay is expected to be paid at time of service, and the amount collected is specifically going to be whatever kind of provider they're seeing. Many times, the amount of the copay depends on if they're seeing a general practice, primary care, or if they're seeing a specialist. Back in the day, copays really never existed, and then once they did, it was a flat amount no matter which provider or type of specialty you saw. Now they're breaking it down into 2, 3, or even 4 different amounts. A lot of times on these plans, when you check the eligibility and benefits, you will see at least 2 amounts, if not 3, if not 4. Most of those will be your primary care, general practice, your specialty, your urgent care, and then also your emergency room. It's important for you as the business owner to make sure that your staff at the front desk understands what they need to be asking for, when, and how to approach that with people. Most patients know they have a copay. Sometimes they unfortunately act surprised, or they say they don't have the money today to pay. And my general practice, and it could be best practice, I guess, is that I always allow patients to have like one get out of jail free card when it comes to paying the copay. But other than that, I expect patients to pay at the time of service because that's what the insurances say we have to do, and that's what the insurances tell the patients they have to do. A lot of times patients don't understand that the copay is an agreement between the insurance and themselves, and they think that the doctor's office has something to do with it, and they want to get mad at you for it. It's important to arm, I guess you could say, your front desk staff with appropriate responses when that comes up. I let my staff know that they are welcome to, and I encourage them to let patients know that unfortunately the copay is an agreement between you and your insurance company, and per our contract, in order to see you as a patient, we have to collect that at the time of service. I also let them know that they are welcome to tell the patient that, oh, we totally understand things happen, you left your wallet at home, or you're in between paydays, so we can bill you for your copay this time, but moving forward we will have to collect it at the time of service. Just being direct but kind and understanding can go a long way. I also ask the staff to put pop-ups in those patients' charts just so that we know that they kind of used their get out of jail free card, and that they will be expected and asked to pay moving forward, and it's documented. If you don't collect the copay at the time of service because you don't see that they have a copay or they don't have the money, it can get really expensive to be sending out statements just for a $10 copay, just for a $20 copay. Think of all the work that goes into having to print the statements, mail the statements, the cost of the paper, the cost of the ink, the cost of the time it takes for the staff member to process the payment once it's received, how long it can wait on your books, and then it's not even worth the money because it's been sitting out there for 3 months because they didn't put it as a priority to pay, and it's a measly $10, $20. And when I say measly, I don't mean that it all adds up and it all is great to have. I'm just saying that it loses its worth after so much time. It's really important to emphasize this to your staff and explain to them why it's important to collect at time of service. A lot of EHR systems will actually tell you how much their copay is for the specialist, for the primary care, for the urgent care. And then there should be a place for you to input that copay so it prompts them every time the patient checks in to collect that amount. A lot of times the catch is entering that amount into the appropriate place. Like ECW or eClinicalWorks, you can check the eligibility and benefits. It will tell you the copay amount, but they don't automatically populate that into the insurance. So you actually have to make sure that your staff member goes out of there, goes into their insurance screen and enters that copay amount. My staff always asks me how much the copay is that they should be collecting, because in their eyes, we're in urgent care in the way that we're operating because we are seeing acute care, immediate care needs. But our taxonomy and how it's billed through the insurance with our MPI-2 and all of that is family medicine. So I tell my staff that we collect the primary care amount because that's how our taxonomy is at the insurance company. If we had the taxonomy of an urgent care, then we would definitely be collecting the urgent care amount. But we are reimbursed on a fee schedule based on family medicine, thus we collect the family medicine or primary care copay amount. Make sure you know what your taxonomy is and how it would be classified so that you can make sure that your staff collects the appropriate amount. Usually the primary care amount is less and the copay amount for a specialist is higher, and then urgent care is even higher and the ER is highest. That's not always the case, but that's a trend that I've noticed, and it's very rare that you will see the same amount for all of them. You might see the same amount for primary care and specialists, especially if they have like a high deductible plan and their copays are like $50, and yes, that is something that happens now, is that seeing a primary care or specialist could be $40, $50, $60, and that's something to look out for. And that's money that you get directly into the bank that will help you pay your bills, your overheads, your payroll, those things. And it's nice to kind of have that. This is also a good segue into having those cost share conversations with your patients from your front desk staff and letting them know that they have a copay, but they'll probably still have to have a deductible met, or they'll have a co-insurance, and that after the insurance processes that, they will get a statement in the mail. Now it's up to you whether you want to collect some money up front as a deposit or a payment towards those deductibles and co-insurances, but we can talk about that in a different video. But definitely the copays are very, very important. They lose their value if you have to bill them out because it costs you more money to collect that money. It's an agreement between the patient and the insurance company, and also in your contracted agreement as being participating that you agree to collect that amount. And it's definitely one of those things where you're just letting the patients know that you're aware that they're going to have a cost share amount and that you're going to be diligent upon collecting that. And then maybe it will be kind of more in the forefront of their mind of making sure that they pay you when they come in for their visits and also when they receive statements for account balances. If you have any tricks or suggestions on best practice of training your staff up front on knowing and approaching that subject with patients on collecting the copay, or workflow suggestions, please leave that in the comments below. If you have had any struggles that you're wanting some suggestions on, I'm happy to help, so leave that in the comments too. And I definitely encourage you to go back, read your contracts with all your payers to understand this, and also make sure that you are able to educate your front office staff to collect that money up front. It's better in the long run, I promise you, and you're also fulfilling those obligations that you have agreed to for those insurance companies. One last note I almost forgot is that you cannot consistently waive those copays for people because you can get in a lot of trouble with Medicare, Medicaid, and the insurance companies in which you have signed agreements. So if there is a special circumstance in which you know a patient is very hard up and having some financial struggles and you want to do this as a mercy and grace type situation, you just want to make sure you have a policy set of when you make that exception and that it truly is a rare exception, and that you document why, so that if if you were ever audited and questioned why you waived that copay for a specific patient on that specific or only circumstance, you're able to go back and remember and say, oh, you know, they lost their job, their spouse just died, they had no income, and they really were sick and needed to be seen, and I didn't want to keep them from being able to receive health care treatment. Then I think that would suffice, as long as you, one, again, you have a policy about that situation, it's used rarely, and you document that specific instance in the patient's chart of why you waived that copay or that deductible or whatever it may be. Have a wonderful day. Subscribe to my channel if you haven't, and hit that thumbs up, please, to help with the YouTube algorithm. Take care of yourself and stay healthy. Bye-bye.